Hello, good morning, ladies and gentlemen. First of all, let me begin by introducing myself to you. I'm Alice. My full name is Alice Dawati, but I will be to called Alice. I'm a nurse at Kanjuran Hospital. In addition, I am also a student at Stickers Pandirape. Thank you for coming today. It's good to see you all. Today I will share about meningitis disease for you. I have been looking for this journal in Mutakin 2008 in NERA 2019. I also studied my topic in this lesson medical surgical nursing. Therefore, the purpose of my presentation is to find out what meningitis is an environmental reaction of the anterior of the brain meninges, which is characterized by the presence of white blood cell in the cerebrospinal fluid caused by virus, fungi, and bacteria that spread into the blood and move into the cerebrospinal fluid. The care of attention getting the best I plan to use its starting fact. Bacterial meningitis can be fatal in 50% patients when left untreated. Even with early diagnosis and proper treatment, 8 until 70% of patients die within 24 until 48 hours of symptom onset. As many as 10 until 20% of patients who survive will be susceptible to brain damage, learning disorder, and hearing loss. Many of these patients experience various problems, so that they need a nursing process. The nursing process is carried out to identify problem, prevent, and overcome nursing problem experienced by patient, both actual and potential nursing care received by patient. Efforts are being moved to improve the quality of nursing care by implementing various nurse. The first thing I will present is the definition of meningitis. Meningitis is information of the meninges of membranes that surround the brain. The second about cause meningitis. Meningitis can be caused of bacteria, virus, or fungal organ that spread into the blood and move into the cerebrospinal fluid. The third thing I will present is people at meningitis. They are pregnant women, needed people who are over 60 years old, people who live in the populated residential, people who live in environment with love of animals, people who have a weak immune system. The fourth thing I will mention in sign and symptom, meaning such as fever, headache, and fever, change in level of consciousness, sickness. There are seizures as well, irregular breathing, and rapid pulse, nausea, and vomiting. The fifth, the elder patient is prevention. Vaccination can be recommended for children and adults for who are at risk, according to Angreni with the 2019. Many this can be prevented by adopting healthy lifestyle behavior, such as wash hand properly every time you do activity, keep a distance for vintage people, use a mask if you are sick, record exercise in a flash. The same thing about types of diet food, the ATP diet to meet energy and protein needs to increase endurance, energy source, constant rice flour, wheat flour, sugar flour, sugar, margarine, coconut or peanut oil. Source of boiling substance, example coarse meal, such soybeans, eggs, green bean, boiled. Source of regulated substance, example citrus fruit, tomatoes, papaya, substance, eggplant, pumpkin, and carrot. Well then, nervous system infections such as acute bacterial meningitis are serious problem that must be identified and treated quickly and efficiently. In conclusion, I would like just to say what can be done to treat meningitis in the early stage is to perform an examination by recognizing the sign and symptom of meningitis so that it can be identified and treated quickly and efficiently. Meningitis can be prevented by adopting healthy lifestyle behavior, and my advice is to do prevention and vaccination for children and others who are sick. Prevention is better than cure. Okay, ladies and gentlemen, thank you for attention. Maybe useful for you lives. Good morning. See you next time.